So what we're going to be working on is the sutures. Now, when we do the sutures, what we're going to start to get into now is listening and following. Okay, listening and following. So you're going to pick it up and you're going to observe. So you're going to notice that could be hold space, could be realignment, could be a molding, could be anything. And now you can use any activating force you want. Not what you want, but you're going to ask the patient what it is. So you can start to use the whole chart, okay? So the first thing I do is what? Recalibrate. Show me yes, show me no. Good. So we're online. Next thing I ask is permission. Permission to learn, right? Not to treat somebody. I'm going to treat, but permission to learn because it's an exercise. So permission to work on the sutures, and I can use anything in the chart. So I have permission to do that. All right. So what's a quick way I can navigate? I can say, is it something in the face, the vault, or base? So is the face a priority? Is the vault a priority? Or face, no. Vault, no. Cranial base, yes. Who would have thunk, right? Cranial base. So in the cranial base, we have that there. So you can, if you have a picture there, you can sort of look in and see, you know, what grabs your eye here. So what grabs my eye is actually where the temporal bone comes in there, not so much with the occiput, but with the sphenoid. Okay? And it's actually going to be on his left side. So what I'm going to do is I'm just going to feel his temporal bone. And when I feel the temporal bone, I feel this asymmetry like this. Okay, so I can feel that. Who here has done cranial for a while? Who has a good cranial background?
Christine.
You've done it? Yeah,
yes.
Come on up. So temporal bones are off. And what I'm going to do now is I'm going to go on the sphenoid. I'm going to stabilize his frontal bone, and I'm going to try to glide his sphenoid to the left. Doesn't move. And then I try to glide this way, doesn't move. So I'm trying to glide the sphenoid left and right. So I stabilize the occiput. My thumb is on the sphenoid, and I'm gliding. Doesn't want to move at all. So his sphenoid is very stuck. And the temporal...
Frontal.
No, sphenoid.
No, you were stabilizing.
Stabilize the frontal.
Yes.
Yeah, you said
Yeah.
the
Did I say occiput? Sorry. Yeah. Stabilize the frontal, and I'm gliding the sphenoid.
Gliding inferior?
No, sideways.
Lateral.
Lateral.
Okay.
Yeah. And I can feel the temporal bone, and there's asymmetry there, and definitely that's stuck. So his temporal bones are locked. Okay. Sphenoid is locked, and that's what I'm feeling. So you can feel that. And you can feel the cranial rhythm if you want as well. Feel the mastoids, and you can do a little tension test on the mastoid. Very, very stuck. Okay. So I can use a prop like this. This is the sphenoid. This is the temporal bone coming in. So this is where I feel the restriction. So I can just hold it here. And now I'm starting to observe. So now I can see that sphenoid coming up, and you can breathe in and out. And I can see, there we go. So this is how I use these bones. You can see the motion there quite a bit. There it goes. And then breathe in. And out. Breathe in. And out. So I need to tap, specific tapping in this area. Good. Breathe in. And out. Breathe in. And out. Good. So now, I'm just going to come back here and feel. So both mastoids are now even. I can get better motion there. I'd say the right one is moving a bit better than the left. Sphenoid's beautiful now. It's moving to the left. But it's just moving to the left.
Yes, it is.
Yeah, doesn't move to the right just yet, but huge shift this way. So we have some more to do. All right. Is the cranial base still the priority? Says no. Okay. Yeah, is the cranial suture still a priority? Yes. Okay. Is the face a priority? No. Is the vault a priority? Yes. So we got to do something in the vault. So in the vault, does it have to do with the coronal suture? No. Sagittal suture? No. Lambdoidal suture? No. Occipital mastoid suture. So occipital mastoid suture. So back in here. And let's see which side it is. It's going to be the left side. So between the occiput, right, and the temporal bone. So where's my other bone here? So this comes in like this. So you have the occipital mastoid suture. So it's actually wanting to compress quite a bit. So it's coming right into it. Occiput's not moving at all. So it's all temporal. You can breathe in and out, start tapping. So it's all the temporal bone moving. Occiput's not moving at all. It's kind of shaking. And that was it. Okay, and breathe in. And out. Okay, I'm going to tap down here, breathe in. And out. Breathe in. And out. Breathe in. And out. Good. So now I'm going to come in here and have a feel. Mastoids still feel good. Let's see. That's nice. Oh, it's much better on each side. He's nodding his head. Yeah. So that feels better. Good. So now I'm going to come up to the sphenoid, moves to the left beautifully, and now it moves to the right. So you can have a feel now. So that was interesting. Even though it was that suture, it's just the temporal bone that was moving. So what I'm feeling is the mastoids were level. When I did a little tension test on them, that was fine. The sphenoid now glides left and right. So you have to stabilize here as you glide that way. And Herbert, I'll get you to comment on it because you knew exactly as I was doing it, you could feel it.
It was very clear when we did the first part, and the sphenoid went easily to the
right.
To the right.
After we treated the first treatment.
First treatment,
yeah.
And after the second one, it was even looser. The mastoid, occipital mastoid suture, and it would glide both ways, as easy as in the first treatment. So yeah.
You know, and you know, I love using those models because if I'm working on a suture, I'll take one out and I'll just follow it. It just brings it to life a little more, and you just see what's happening because you saw how the occiput, your occiput was still. And the temporal bone, all the temporal, this was kind of like shaking like this, but this was like doing all the movement itself. You know, so it doesn't mean that both sides have to move. Again, you're just observing. You're just seeing, you know, what's happening to the body. Okay. So here's what we're going to do. Grab a partner.